Stop what you are doing right now because what I'm about to explain could genuinely make a difference for your life or someone close to you. Across parts of the United States and other regions, there is a virus that rarely gets public attention in everyday conversations, yet it continues to appear in serious medical cases with very little warning. Many people, including older adults, end up in intensive care before they even realize what is happening. This virus is called hantavirus, and in this explanation, I'm going to break down what it is, how it enters the body, what it does once it gets inside, and most importantly, what adults, especially those over 60, need to be aware of to reduce their risk. If you're new here, this is the Nutriome Lab. The focus here is on explaining health topics in a clear, research-based way, especially how diseases and biological changes affect the body as we age. What you're about to hear is time-sensitive and important. According to data from the Centers for Disease Control and Prevention, the most severe form of hantavirus infection, known as Hantavirus Pulmonary Syndrome, has a very high fatality rate, estimated between roughly 38% and 50%. That means in severe cases, about 1 in every 2 people may not survive. This is one of the reasons researchers take it seriously, even though it remains relatively rare compared to many other infections. One of the biggest concerns is that older adults are more vulnerable. As we age, the immune system naturally becomes less efficient, sometimes significantly so compared to younger adults. This reduced immune response makes it harder for the body to react quickly to new infections, including viral exposures like this one. Before going deeper, I want you to think for a moment. How old are you? And have you recently spent time in places like storage rooms, barns, sheds, cabins, garages, or anywhere that might have signs of rodents? Even if it doesn't seem important, these details matter more than most people realize. Just keep that in mind as you continue. Now let's understand what hantavirus actually is. Think of your body as a highly protected city and your immune system as its security force. Now imagine a microscopic intruder that doesn't enter through obvious routes, but instead slips in quietly, bypassing normal defenses and heading straight for critical systems like your lungs and cardiovascular network. That is essentially how hantavirus behaves once it enters the body. Hantavirus is an RNA virus, meaning its genetic material is stored in a simple but highly efficient format that allows it to hijack healthy cells and force them to produce more copies of the virus. It belongs to a group of viruses that have long existed in nature, primarily within rodent populations. In North America, the main carrier is the deer mouse. The important thing to understand is that the rodent itself usually does not get sick. Instead, it carries the virus silently and sheds it through urine, saliva, and droppings into the surrounding environment without any visible signs. Different regions of the world have different strains of hantavirus. In North America, one of the most well-known is the sin nombre virus, first identified in the early 1990s after a cluster of sudden and severe respiratory illnesses occurred in the southwestern United States. In South America, the Andes virus has caused outbreaks in countries like Argentina and Chile, and it is notable because it has, in rare cases, shown the ability to spread between humans through close contact. In parts of Asia and Europe, related strains tend to cause a different illness that affects the kidneys more than the lungs. Despite these differences, all hantavirus strains share one important pattern. They tend to affect the body more severely when the immune system is weaker or less responsive, which is why age can play a role in risk. Now let's talk about how infection actually happens, because this is where most people misunderstand it. The primary way people become infected is through breathing in contaminated particles. When rodents leave droppings, urine, or saliva in enclosed or undisturbed spaces, those materials can dry out over time. Once disturbed, by sweeping, cleaning, moving old boxes, or simply walking into a closed-off space, tiny particles can become airborne. These microscopic particles can then be inhaled without the person realizing it. Once inhaled, the virus travels into the respiratory system and reaches the lungs, where infection begins. Studies have shown that under certain cool and dry conditions, the virus can remain active in the environment for a period of time, which increases the importance of careful cleaning practices in potentially affected areas. Less commonly, infection can happen through direct contact with contaminated materials, followed by touching the face, eyes, or mouth. Rodent bites are rare, but also possible. In some specific strains, particularly the Andes virus, limited human to human transmission has been documented, but this is not the primary mode of spread. As we age, our natural lung defense mechanisms also become less efficient. The tiny structures in the airways that normally help trap and remove particles do not function as strongly as they once did. This means that when harmful particles are inhaled, they are more likely to reach deeper parts of the lungs where more serious damage can occur. After exposure, there is an incubation period, meaning a delay between infection and symptoms. This can range from about 1 to 8 weeks, most commonly around 2 to 4 weeks. During this time, a person may feel completely normal while the infection develops silently in the background. When symptoms finally begin, the first stage often resembles a common flu. People may experience fever, fatigue, muscle aches, especially in large muscle groups like the back, thighs, and hips, along with headaches, dizziness, chills, and sometimes nausea or vomiting. Because these symptoms are so general, many people do not immediately recognize the seriousness of what is happening. This early stage is what makes hantavirus particularly dangerous. It does not announce itself clearly at the beginning, and by the time symptoms worsen, the infection may already be affecting the lungs in a much more serious way. In the next stage, the illness can progress rapidly, especially in severe cases, which is why early awareness of exposure risk is so important. They don't just assume it's influenza, COVID-19, or some routine viral infection. That's exactly why this stage is so dangerous, because it looks ordinary while something far more serious is developing underneath. During this early window, the virus is actively multiplying inside the cells that line your blood vessels, known as endothelial cells. As the infection spreads, it starts damaging these cells and causes them to become leaky. That's the turning point where the disease shifts from a mild flu-like phase into something far more severe. Within roughly 4 to 10 days after symptoms begin, the illness can move into what doctors refer to as the cardiopulmonary phase. This is the stage where people often end up in emergency care. At this point, the blood vessels in the lungs start leaking fluid into the air sacs. The lungs, which normally function like a light, air-filled sponge, gradually fill with fluid instead. Breathing becomes extremely difficult, not just mild shortness of breath, but a severe and frightening struggle to get enough oxygen. As oxygen levels drop in the blood, the rest of the body begins to suffer. Blood pressure can fall, and the heart is forced to work much harder just to keep circulation going. Without enough oxygen, it can quickly become overwhelmed. This condition, known as Hantavirus Pulmonary Syndrome, can progress with alarming speed. In severe cases, a person can go from mild breathing difficulty to complete respiratory failure within 24 to 48 hours. That is why many patients require intensive care and mechanical ventilation very quickly after hospital admission. Even with modern medical support, treatment is not straightforward. There is currently no specific antiviral medication that targets hantavirus directly. Care is mainly supportive: oxygen therapy, mechanical ventilation when needed, careful fluid management, and close monitoring while the body fights the infection on its own. In other words, recovery depends almost entirely on how the body responds, not on a targeted cure. For those who survive the most critical phase, there can be a gradual recovery period. Fluid begins to leave the lungs, often through kidney function, and breathing slowly improves. But recovery is not always quick. Some people take weeks or even months to regain strength, and in certain cases, reduced lung capacity and lingering fatigue can last for a long time. This is also why prevention and early awareness matter so much. Once the disease reaches this stage, options become limited. To understand how real this risk can be, it helps to look at documented cases. One widely reported outbreak occurred in Yosemite National Park in 2012. Several visitors who stayed in insulated tent cabins developed severe illness shortly after their visit. Investigations later found evidence of rodent contamination in the structures. Multiple confirmed cases were linked to the exposure, and some individuals did not survive. The outbreak led to major changes in how those accommodations were designed and monitored. In another case in Washington state, a man in his early 60s developed the illness after cleaning out a long unused storage barn on his property. He did not use any respiratory protection, assuming it was routine work. Within days of symptom progression, his condition worsened rapidly, and he required intensive care and ventilation. He survived, but recovery took many months, and his lung function never fully returned to its previous level. There have also been documented clusters in parts of South America involving the Andes virus, where limited human to human transmission has been observed in specific settings, including close household contact and healthcare exposure. These outbreaks have been closely studied by health authorities because of their unusual transmission patterns compared to other strains. In the United States, cases tend to appear sporadically in regions where rodent populations are higher, particularly in certain western states. Public health agencies have noted that many cases occur during times when people are more likely to clean out or enter older, enclosed spaces where rodents may have been present. In some reports, adults over 60 have been among those affected, and in severe cases, outcomes can be more serious due to reduced physiological reserve and immune response with age. Now, this is where the focus shifts from understanding the disease to practical protection. There are several key actions that can significantly reduce risk, especially for older adults who may come into contact with potentially contaminated environments. The most important point to understand is that risk is not just about location, it's about exposure during disturbance of contaminated dust or materials. That is why activities like cleaning old storage areas, sweeping enclosed spaces, or handling rodent nesting materials without protection are considered high-risk scenarios. From here, the priority becomes simple. Reduce exposure, use proper precautions in enclosed or rodent-prone areas, and avoid directly inhaling dust from potentially contaminated environments. Next, it becomes about recognizing which environments carry the highest risk and how to handle them safely. And I want you to stay with me until number one, because it's the one thing almost nobody is actually doing, and the reason behind that is more important than you might think. Starting with number 5. The first step is to carry out a thorough rodent inspection of every enclosed or rarely used space on your property within the next week. Not later, this week. That includes your garage, basement, attic, garden shed, crawl spaces, storage rooms, and any vehicles or structures that sit unused for long periods. What you're looking for are clear indicators of rodent activity. That means droppings that resemble small, dark grains, bite or gnaw marks on wood, plastic, or stored food containers, shredded materials that could be used for nesting, such as paper, fabric, or insulation, grease or smear marks along walls where rodents repeatedly travel, and any strong, musty, or unusual odor that often signals an active infestation. But here is something important. Do not inspect these areas carelessly. Avoid leaning into closed or poorly ventilated spaces without precautions. Always open doors and windows first, and allow air to circulate for at least 30 minutes before entering. If you do find signs of rodents, do not start sweeping, vacuuming, or disturbing the area with dry cleaning methods. I'll explain the correct approach in a moment when we reach the next steps. This inspection matters because research from the University of New Mexico has shown that a noticeable percentage of deer mice in certain rural regions carry hantavirus. That means exposure risk is not theoretical in those environments. It exists in real measurable levels. As people age, the immune system becomes less efficient at responding quickly to new pathogens. The early first response defenses are not as fast or as strong as they once were, which means the body has less buffer time when dealing with unfamiliar viral exposure. This is why prevention becomes increasingly important with age. A practical tip here is to never do this alone if possible. Having someone with you adds safety, support, and ensures help is available if anything goes wrong or if you feel unwell while working in enclosed spaces. Now moving to number 4, and this is where many people make a serious mistake: protective equipment. When entering any area that may have rodent contamination, proper respiratory protection is essential. This means using a certified N95 respirator that fits tightly around the nose and mouth. Not a cloth mask and not a basic surgical mask. Those do not provide sufficient protection against fine airborne particles. Along with that, disposable gloves should always be worn to avoid direct contact with contaminated materials. In more heavily affected areas, protective clothing that can be removed and cleaned immediately is strongly recommended. It may feel excessive, but the reality is simple. Basic protective gear costs very little compared to the medical consequences of exposure, especially for older adults whose lung capacity and immune resilience naturally decline with age. Before entering any potentially contaminated space, it is also important to ventilate it first. Open windows and doors and allow fresh air to circulate for at least half an hour. This helps reduce the concentration of airborne particles before you begin any activity inside. Now, number three is where most people make a critical and completely avoidable mistake. If you find rodent droppings or nesting material, never dry sweep, never vacuum, and never use anything that disturbs dust directly into the air. These actions can release contaminated particles into the environment and significantly increase the risk of inhalation. Instead, the correct method is wet cleaning. The area should first be thoroughly dampened using a disinfectant solution, such as a diluted bleach mixture or an appropriate household disinfectant. After allowing it to sit for several minutes, the material should be carefully removed using disposable towels or cloths while still wet and sealed securely in double bags before disposal. All affected surfaces should then be disinfected again, and hard flooring should be mopped thoroughly. This wet cleaning method is significantly safer because it prevents particles from becoming airborne in the first place. At this point, it's important to understand that these steps are not just general advice. They are based on public health recommendations designed to minimize airborne exposure risk in real-world situations. Now, moving to number two, which is arguably one of the most important parts, recognizing symptoms early enough to act quickly. The key warning signs that require immediate emergency care include a combination of fever, muscle aches, especially in the back and large leg muscles, and any form of worsening shortness of breath, particularly if there has been any potential rodent exposure within the past several weeks. What makes this especially dangerous is how quickly the condition can escalate once breathing symptoms begin. In some cases, deterioration can happen rapidly, which is why early hospital evaluation is critical rather than waiting for symptoms to settle. If there is any suspicion of exposure, it is essential to clearly communicate that to medical staff as early as possible. Mentioning possible rodent contact helps clinicians consider the correct diagnostic pathway much sooner, which can directly influence treatment speed and care decisions. As people age, the body's inflammatory response can become less predictable. Symptoms may not always appear as strongly at the beginning, which can lead to delays in recognizing how serious an illness is. This makes paying attention to even subtle changes in breathing or energy levels extremely important. Now, finally, number one, the most important step, and the one most people completely overlook. It is this: having a direct conversation with your healthcare provider about your personal risk before you are ever exposed. Most people never do this. They wait until after something happens. But discussing your risk in advance, especially if you live in or frequently visit areas where rodent exposure is possible, can make a real difference in how quickly symptoms are recognized and managed if they ever occur. It also helps ensure you understand exactly what to look out for and what steps to take immediately if any warning signs appear. This step may not sound dramatic, but it is the one that connects everything together: awareness, preparation, and faster action when it actually matters. And that is exactly why it is number one.